Well, today we're going to be tackling the taboo of women's health.
We've been joined on the line by Victoria Steele, who is the Chief Superintendent Pharmacist at Lloyds Pharmacy. Victoria, thank you for joining us on the show. So why do you think there is a resistance to the conversation around women's health issues?
Well, I think it's a really interesting topic because women generally are very good about talking about their problems with their friends. They're very good at talking to GPs, so making appointments. However, in these times, it's become really challenging to talk to your friends. You've got such busy lives at home. You can't naturally go and meet them for a coffee or a glass of wine and a natter. And it's also really quite challenging to get a face-to-face appointment at a GP. So there are still some conditions that are worrying, that worry women that they don't necessarily talk about. So things like the menopause or low libido, they don't necessarily naturally talk about those.
So how can stress impact the physical health of a woman?
Oh, in so many ways. So it can reduce the immune system. So that means that you could catch illnesses easier, which clearly in these times you really don't want to happen. It can cause some mental health issues like low mood, poor decision making, and lots of women blame stress levels on reduced libido.
So what is the advice that you would give to women looking to combat stress and improve its effects on their intimate health and their relationships?
So firstly, if women are struggling with any conditions, we know that only 1 in 10 women actually go to a pharmacy for any help. So I'd like to remind women that pharmacy is open and there are healthcare professionals there ready to talk to them about any symptoms that they might be having. But from a stress levels point of view, again, I'd just like to remind everyone that everyone is struggling at the minute. Everyone needs to take it a day at a time. There'll be good days and bad days, but if you can maintain some control of your life, so eat well, sleep well, maybe moderate alcohol consumption and try and get some exercise, even if that's a short walk every day.
Have you seen a rise in women's health problems during lockdown then?
So we haven't, and that actually worries us, that we've actually seen a decrease. And I think that's because women aren't talking about it.
So where can women go to seek advice on intimate health and sexual health?
So if they don't feel comfortable speaking face-to-face with somebody, which is totally understandable, there's LloydsPharmacy.com that's got some great advice and help on it. But equally, we've got Lloyds Pharmacy online doctor services, and so they can deal with all sorts of conditions like contraception or any sexually transmitted conditions, anything they can help with.
Now, we are approaching Valentine's Day this coming weekend, and I'm reading here in the research that lockdown libido apparently worries 1 in 3 women, doesn't it?
Yeah, it is from the research, and then linking that in with stress levels being one of the main factors for reducing libido. It's challenging times at the moment. So again, I would just think with Valentine's Day coming up on a Sunday, if people could try and find some time to be alone with their partner. So if that's putting kids in front of a movie or making them go to bed, or if this is achievable, going for a walk together, just trying to spend some time together and talk rather than be cook, clean, teacher, etc.
And of course, at the minute, it really is a stressful time for women. They've got so much going on at home. I know lots of them are involved in homeschooling with the children and stuff. So it really is a particularly stressful time, isn't it?
Yeah, it is. It's incredibly challenging for everyone, but we do know that the majority of the workload is landing on the woman in the house in these times. So it really is important to make sure that they prioritise their own health and get a little bit of headspace every day if they possibly can.
Now, as we all know, it's very difficult at the moment to get doctor's appointments. You've given some great advice there about talking to your local pharmacist. I would imagine as well it's good to talk to your friends about health issues as well, isn't it?
Yeah, absolutely. One of my gorgeous friends that lives near here, she's got a 13-year-old stepson, 3-year-old son and a 2-month-old baby, and I'd not heard from her for a few weeks, so I sent her a message last week and I got straight back, I'm not okay, I'm not coping. So we met for a walk on Sunday, and she has made an appointment at the doctor's, but we just spent an hour just talking. And you know, we're not super women. We can't do everything, and we just need to be able to talk and hopefully share workloads with partners or older kids that are in the house. Whoever can help really does need to try and support each other.
Let's talk about menopause. About a year and a half ago, I went to my GP because I was having menopausal symptoms, and I was told, welcome to the menopause, you've got to just get on with it. Since then, I've avoided going back. A year and a half on, the symptoms are much worse. What would you say to the women out there who maybe are in the same position as me? Would you say it's essential to make an appointment with your GP and not let that put you off?
Yeah, it's really important. It's so interesting that women don't talk about it, and it hits women obviously at very different ages, doesn't it? But I think there are a few reasons. You know, some women think back to their mothers and how they went through it and how they just stoically coped. Well, there's been so many advancements in treatments that I really would urge women not to struggle. Similarly, great friend of mine, about 10 years older than me, she was starting to have symptoms, really reduced energy levels, real brain fog, struggling to make decisions, but didn't have hot flushes, wasn't struggling with sleep. Her mum had just, in her words, sailed through it, which is unhelpful because 80% of women don't sail through it. And so I just urged her to see a doctor. I gave her some NHS resources online for her to do some reading of her own. And she went and she tried a couple of treatments, found one that suited her. And she's, in her words, back to herself, back to living her full and fabulous life. There are so many good GPs out there, and there are many that specialise actually in the menopause to support their patients through this time.
So Victoria, it's been great talking to you. Thank you so much for joining us on the show.
Thanks, Victoria.
Thank you for having me.